Shall we speak to someone who's been on the front line here? Dr. Dolin Bhagawati is a London-based neurosurgeon and is a member of the Doctors Association UK. Are you speaking on behalf of the association or in a personal capacity? Just so I get that absolutely straight and I don't offend anyone, Doctor. Good morning, sir.
Morning. Thanks for having me on, Mr. Ferrari.
Please, Nick, please.
No, thank you. I'm speaking on behalf of the Doctors Association UK.
Okay. When you hear someone in a position of influence making these comments, albeit in November, then refusing to back down, how do you react, Doctor?
So I think what's important here is that part of this is slightly a distraction, frankly. At the moment, we have people dying, we have people on ventilators, we have people who are horrifically sick in a hospital, and I've watched the interviews that Mr. Swain has done on this matter, and that seems to be very lacking in terms of reticence with regards to reflecting on these comments. Any person can be incorrect about predicting the future. It is a very difficult thing to do, and there are lots of factors that can play into it, and some of these are unknown. It is not an admission of defeat to accept that one was wrong in making comments in the past and subsequent events took over. And that is something which is difficult to do in politics, but unfortunately it is necessary to do in health. Otherwise, we don't learn from our mistakes. And if we don't learn from our mistakes in a pandemic situation, people die.
I'm blessed. I haven't had to attend an ICU during the pandemic. What is the reality from you and your colleagues who are there and work there on a daily basis? Are they operating, quotes, at typical occupation levels?
Absolutely not. So none of this is normal in the NHS. At our trust, we have 3 times the level of ITU patients that we had at the same time last year. We have converted several floors of our hospital to intensive care. We have redeployed multiple members of staff. Consultants of all stripes are doing shifts on ITU. People from all specialties have been redeployed into roles that they don't normally fulfill. And this is basically a crisis situation. Now, we talk about the NHS being overwhelmed. Well, that doesn't happen when we have people on ventilators in corridors and people having CPR in the street. That's not what happens. What happens is what you're seeing at the moment, which is frontline staff working far too many hours, who are in exhausting PPE, who are having to have emotionally draining days on a daily basis, having to help patients contact their families and have their last discussions over the phone or over FaceTime. This is horrific. And I would hope that an elected member of Parliament who has people dying in his constituency would help to acknowledge that. Now, I appreciate that lockdown is hard for everybody, and no medical professional will deny that fact. However, in terms of this crisis, there is an immediate, short, medium, and long-term consequence of this that needs to be looked at. The immediate term consequence is our ridiculously high numbers of coronavirus cases and deaths going on at the moment. Our short-term goal is vaccination to try and drive that down. Our immediate term is to reinforce and restart our planned care so we can get treating our cancer patients effectively. And our long term is to deal with our ballooning waiting lists and our mental health crises.